Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for returning for another segment. Cardiologists at Northwestern Medicine are using AI to identify patients with advanced heart failure who require specialized care, including those who might need ventricular assistance devices or transplant. Well, Dr. Ahmad is joining us here as a cardiologist and Associate Director of Northwestern Medicine Bloom Cardiovascular Institute Center for Artificial Intelligence. He's going to talk about heart failure, how AI is giving doctors advance notice on heart failure, treatment options, and a little bit about what else AI can do to help patients. Welcome to Health Professional Radio. Dr. Ahmad, thank you for joining us.
Thank you so much for having me today.
Well, doctor, just how common is heart failure?
So heart failure is pretty common in the United States. It affects over 6 million adults in the U.S. It has a large public health impact, and it's only expected to grow in the coming years. By 2030, it may affect over 8 million adults in the U.S. That may be as high as 1 in 33 adults.
Now, just to be clear, heart failure doesn't mean you just drop of a heart attack at that moment. There's a process, and it could take years for the heart failure to actually, cause your demise.
That is correct. Yeah, the name heart failure isn't the best name, and I think in this field we recognize that. And there's a movement within the field to try to rebrand us as heart function doctors, because our goal really is to keep the heart functioning as long as we can with medications, devices, and lifestyle. And so you're exactly right. It doesn't mean the heart is failing. Heart failure refers to when there are changes in the heart, whether it's the structure of the heart or the function of the heart, that leads to the syndrome that causes a variety of symptoms in patients that can include fatigue, shortness of breath, sometimes the feeling of extra fluid in the stomach or in the legs, and a variety of other symptoms.
Now, are those symptoms, do they present when you're in an advanced stage of heart failure or throughout the process?
So it's a really great question. The symptoms can come and go throughout the course of having heart failure. So often when patients are diagnosed, it's early on in the process, and we call that sort of stage C heart failure. And that time they present with symptoms, are treated hopefully with medications based on decades of clinical trials, and they feel better. Then sometimes they have periods where they feel worse, get treated, and feel better. Then for a subset of patients, they do progress to what we call advanced heart failure or stage D heart failure. We think this is probably around 5 to 15% of patients in the overall heart failure population. And that is defined as having persistent severe symptoms despite our being on the best therapies already. And so it's really this subset of patients we're trying to find as early as we can and bring them in for a heart failure specialist evaluation at Northwestern Medicine.
How is artificial intelligence or AI giving doctors some advanced notice of heart failure?
So we have a very large health system, and there's lots of data being generated every day. So we decided to work with our engineers in our health system to develop and pilot test an AI model to try to use all this data to find these patients with advanced heart failure with advanced heart failure across our system. We also developed an entire workflow that we embedded in electronic health record to streamline the referral process. And the challenge really is that there's so much data and so little time. And that's why something like artificial intelligence can potentially help find these patients. And it's important to try to then develop systems in which we can test and see if these systems work and if they add value to care and make patients healthier.
Now, obviously, lifestyle change is a huge factor. What other steps need to be taken in order to help?
So for all patients with heart failure, lifestyle change is important, like you said, exercising, staying healthy, cardiac rehabilitation in a subset of patients. For most patients with heart failure, in conjunction with your medical team, it's important to discuss what medications, devices, procedures can help them. And then if you are prescribed medications, it's really important to take them as they're prescribed, because a lot of these medications are really life-saving therapies that make patients feel better and live longer.
So you talked about decades of research and treatment as far as some of the medications. What about some of the new treatment options? Have there been some great strides in treating heart failure recently or in recent years?
There have been a lot of different new treatments that have come out in the last several years. Some of these are medications, the new types of medications for certain types of heart failure, and some of them are procedures. Like at Northwestern, we offer a number of minimally invasive ways to fix heart valves, and including a valve on the right side of the heart called the tricuspid. Before, surgery or medical therapy was only option for them, but now they can. Certain patients may benefit from these minimally invasive, really novel procedures. This is why for patients with heart failure, it's really important to get them to see a specialist to try to figure out what's the best treatment, and then to offer that treatment at the right time when patients will get the most benefit if it aligns with their goals.
Talking about that time frame where the benefits are best, when do you as a specialist normally see these symptoms present? Are we talking middle age, old age, or are there some symptoms being seen in younger people?
That's a really great question. So heart failure is a very diverse syndrome and can affect patients at different ages and with different risk factors. So if you look at the epidemiology of heart failure, most patients, the largest group of patients, are older. But there are certain types of heart failure, like patients with a genetic predisposition and other types that can present at a young age. So really, it can really affect anyone across the age group, and it really just depends on the risk factors that they have.
Now, is early warning the only use that AI is the only thing that AI is beneficial in when it comes to heart failure? Are there other applications as well?
Yeah, so we think that here in Northwestern that there are a lot of other applications for AI, and we also think it's really important to test all these applications regularly to make sure they're making patients healthier and adding value to care. And so another example of using AI in care is trying to use AI on heart ultrasound images, which are called echocardiograms, to try to identify rare causes of heart failure, like cardiac amyloidosis. We've also worked with a company to see if we can help them reimagine the stethoscope, to try to use AI to analyze stethoscope sounds to find heart failure valve problems earlier and see if that improves quality of care. And so we really do think AI can be used for a broad set of cardiovascular conditions. And we just think it's really important to test these rigorously and make sure that they're improving quality of care. What
types of questions or feedback do you get from patients when you're talking about this new technology for their particular heart failure condition?
Yeah, so patients, so when we're talking about AI with patients are generally excited to learn more, in my experience. You know, we've seen AI affect so many different parts of our lives, you know, on our phones, with self-driving cars that are being tested. So we are interested to know how it helps, but people are also interested in knowing if it really does help and trying to understand how it will make them feel better and make sure it's appropriately tested.
Now, in your experience, what type of feedback are you getting from practitioners that are using this new technology who have been, you know, using other technology for maybe decades?
I'd say it's been a mixed experience. I think there are some clinicians who are very excited about trying new technologies. And are really excited about the potential of AI. And then there are other clinicians who don't have much experience with AI and are hesitant and want to see more evidence and want to really understand how it works. And I think both are very reasonable. I think in medicine, we want to make sure we're following evidence-based treatments, and AI is, if we're using it as part of diagnosis and to inform treatments, we want to make sure the evidence is there. So I think there's a wide range of reactions to AI, and that'll continue to change over time.
Is there anything that you'd like to add for our listeners, and then give us a website where we can learn more?
Yeah, so I think here at Northwestern Medicine and Bloom-Carson Institute, we're really excited about the potential of AI, and we're really excited to partner with patients and companies to try to develop and test these new technologies. If anyone would like to learn more about the Bloom-Carson Institute or our work, please visit heart.nm.org.
Doctor, it's been a pleasure speaking with you. Thank you so much for your time this morning.
Thank you so much for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Faraz Ahmad. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.